This video is intended for Dr. Lamb's patients who had a hair transplant. So the purpose of this video is to help you during the recovery time and just summarize the instructions, what to do and what not to do. First, we recommend that you take pain medication as needed. Second, we recommend that you spray ATP spray every hour, first evening, and then first night every 2 hours. And after that, you will be spraying every hour or as often as you think. In your spray, you should last you for 2 to 3 days. Then we talk about, and there you get post-operative instructions. Make sure that you review them. Then you're going to sleep elevated with 2 pillows, no more than 2 pillows for about 2 to 3 nights. And you can, for the first night, you can protect your pillow because there may be some oozing from the donor area. Usually you are okay to sleep on your stitches or the donor area where we took the hairs from, but you just want to be very careful with the area where we put the hairs so you don't dislocate the grafts and damage them. So when you look at your instruction sheet, you're going to see that we recommend that day 1 after the surgery, you start taking anti-swelling medications as prescribed. Continue spraying your ATP. And then you can put a hat on. Be careful if you have any grafts in temples, just make sure that you don't dislocate them or the loina crown. Make sure you limit your activities for the day 1. And then wait until that evening to wash your hair. Usually you have an appointment in Dr. Lamb's office, so we'll see you and repeat all this again. After you wash your hair, if you had a suture, the FUT procedure, you're going to apply your gel regenicin, and that gel should be applied twice a day, and it should last you for a week or so. And if you finish your bottle that we gave you, don't worry, you don't need to continue that, even though the packaging on the bottle will say that it may last for several months, because your suture line is long and it's intended to be applied for only several days after the surgery. The day 2, you can start doing resuming your physical activities. Lightweight lifting, light running, just avoid anything that can raise your blood pressure suddenly. And when you go to the gym, be careful not to put your head on any area that is commonly used and can be dirty. You may start to notice swelling. Swelling may show up in the forehead, eyelids. It may be so big or disturbing that you can barely recognize yourself. Don't worry, that's totally normal. And the swelling may last 2 to 3 days. This is why we gave you anti-swelling medication. So the swelling should slowly subside. Just be aware that the more you keep your head down, the more swelling will accumulate in your face. When you're washing your hair, after you wash, and I want you to wash with your fingers and touch your scalp, please make sure you don't use a cup. So I want you to really rinse everything and clean it properly. The cleaner your donor area and recipient area, the better they heal and the faster the scabs come off. So even if you want to wash your hair twice a day, it's okay. Use conditioner after you wash your hair, and within several days, if you start noticing that your scalp is dry, you can apply any type of scalp moisturizing such oil or lotion, such as like vitamin E oil or argan or coconut oil, and usually apply it at night and wash it off in the morning. Hair products can be used 3 days after, and you can use blow dryer and you can use comb and comb. Just be gentle and careful not to catch scabs or stitches in case you had sutures. And then you can use a laser cap if you were using it before the procedure. So within a day 2, you can resume using a laser cap. Wait until 7 days to use minoxidil, and usually we recommend that you don't stop using Propecia around the surgery. You just continue. And if you had procedure done where the hair was harvested from the beard, make sure that you wet shave the second day and thereafter for 1 week. And after 7 days, you can resume normal physical activities. You can resume normal hair washing, and after 7 days, you should not have any scabs left. And especially not after 14 days. If scabs are remaining on your scalp after 14 days, they compromise healing and hair growth. So that's not a good thing. So feel free to stay in the shower a little bit longer, apply conditioner, massage your scabs, and as they're moist, they can easily slide off of your hair. And then after that, you're going to see there's like a little hairs remaining for about 2 weeks. And if you had eyebrows, they stay like a full eyebrow for about 2 weeks and they fall out. So I would say eyebrow transplant. So whichever procedure you had, the transplant hairs will stay for about 2 weeks and they fall out after that. So that's totally normal, and they should start growing back within 3 months. And remember, when they start growing back, 3 months, they are just the beginning. It's like a first day of spring. It will take several months before all hair grow in. So you're going to see good results between 5 and in 9 months. We usually see you in the office if you had a suture, stitches, you will come 10 days after to have your sutures removed. And you can cut or color your hair 10 to 14 days after the surgery. And finally, I want you to just remember that you may have some postoperative shedding. That's totally normal. The area where we transplant the hair sometimes has hairs that they are weak and they get disturbed with the surgery. And then within about 2 weeks to up to 4 or 5 weeks, you may have some slow shedding of that hairs in the recipient area. That's totally normal. Those hairs will return within 3 months. So don't worry, it is just part of the healing and recovery. So I hope this video helped you remember and recover better. And we're looking forward to following up with you and seeing your results.